Hi, everybody. My name's Courtney Wilgus. We've met before. I work for Presbyterian, and I am here with Dr. Wolfgang Stair. He is a pediatric surgeon that is with Presbyterian Medical Group. He works out of our Presbyterian Hospital campus on Central. So glad that you're here, Dr. Stair. Welcome.
Thank you, Courtney.
Oh, thank you. So tell us, what does a pediatric surgeon do?
Look, some people say pediatric surgery is the last bastion of general surgery because we basically cover the entire body. We operate on the belly, we operate on the lungs, we operate on the neck, we operate on skin, hernias. So we really do a lot of different things. And the other thing that's really interesting, we cover babies from the moment they're born to the age of 18, sometimes a little bit longer. And of course, we also see moms who had a diagnosis while they're still pregnant. So we do prenatal visits as well.
Wow. So really, any age child and into early adulthood, you guys are covering all of their needs surgically. That's fascinating. And I bet that keeps it interesting for you.
Yeah, it's very interesting.
Well, let's talk about something that you might commonly see. So a kiddo that has appendicitis. What's that typical experience like for a family that has a child with appendicitis, and how do they end up in surgery?
Yeah, so appendicitis is probably one of the most common emergent operation that we do. We do one or two every day, which means it's like hundreds per year. And it's also something that can happen at any age group. So kids as young as 2 or 3 can get it. And then, we see appendicitis up until the age of 18. And the common symptom is not feeling well, fever, nausea, vomiting, and then the classic right lower quadrant abdominal pain. And the younger the child is, the more vague the symptoms are. And the older the child is, once they can say, I'm not feeling well, my tummy's hurting, it's hurting here on the right, that makes the diagnosis a little bit easier. So you asked, what is their course like? So very often, because the symptoms can be vague, many parents try to cure it at home, and they give some Tylenol or they give some other medication. We actually don't recommend that. We really recommend that they speak with their pediatrician kind of early on, or even go to an urgent care or an emergency room where the child can be evaluated by a doctor. And then very often we get an ultrasound because we want to try to avoid the radiation of a CAT scan. And there's some blood work that gets done. And with those tests, we get it very, very narrowed down to the right diagnosis. And then the child gets transferred here to us at Pres Main. And then either the same day or the next morning, we will do the surgery. And that's the course for about 80% of the kids into the operating room. It's an operation we do with a laparoscope. So little camera and little incisions. And the surgery takes about an hour to an hour and a half under general anesthesia. The recovery after the surgery depends very much on what we see when we find the appendix, which means if it's caught early, then most kids can go home within 24 hours. If, however, the diagnosis is delayed, then the appendix can rupture and the child will have to stay in the operating room, in the hospital longer, sometimes as long as a week, to be treated with antibiotics until all the infection is cleared up, which again is really a good reason to go seek help early, get an ultrasound, and then hopefully make the right diagnosis.
Absolutely. Thank you so much for explaining that. I actually had my appendix out in my early 20s, and I was one of those people who waited too long and ended up in the hospital for a while. So I appreciate the fact that you're encouraging people to seek care early.
Yeah.
And some folks may not know, but at Presbyterian, we actually have 3 pediatric urgent cares in the city, one in the South Valley at Las Estancias, one in the Northeast Heights on Carmel, and one in Rio Rancho at our high resort urgent care. And they're actually pediatric providers that are there specifically for kids that have that experience and know what to look for if you're not sure as an adult. And wow, absolutely. I had a doorbell there. We're at home doing this virtually, so little surprises like that. Sorry if you heard my doorbell. But I appreciate you sharing that with us. That's
Yeah.
so important to get kids the care they need when they need it.
Yeah. I'd like to say one more thing about the ruptured appendicitis, right? So the longer you delay the care or the diagnosis, the more likely that the appendix can rupture. Now, a lot of people are still very scared of ruptured appendicitis. But today, because we have good antibiotics and we have other ways to treat it, it's no longer the scary disease that it was maybe 40 or 50 years ago. But that should not prevent people from going to the hospital. And we actually saw a lot of hesitancy from people going to the hospital because of COVID and the coronavirus.
Yeah.
But I just have to tell you, I think here in the hospital is probably one of the safest places because, of course, we screen the patients and we screen everybody who walks in. And so I think the risk of getting coronavirus while in the hospital is really, really low. And same with the urgent cares, right? I think going there, getting the ultrasound is very, very safe. And yeah, I encourage people to do that.
Thank you so much. You seem to really enjoy your job and be committed to it. What made you want to become a pediatric surgeon?
Yeah, for the longest time, I wanted to be a pediatrician. And then my very last rotation in medical school was pediatric surgery. And I just absolutely fell in love with it because, one, you interact with the kids and you interact with the parents. And at the same time, you have all the skills and tools and ability to intervene and repair things that a surgeon does, right? So I say, yeah, pediatric surgeons are a pretty special breed because it takes a long time to train. We all trained in adult general surgery and then in pediatric surgery. So it takes a special person with a heart to do this job, and I just love it.
I'm so glad. Thank you for going on that path. Speaking of that, what do you hope to accomplish with your patients? What's your hope for them when they come to see you?
Yeah, ultimately, of course, it's making sure we can address the condition or the question. But initially, it's really developing a relationship of trust and a relationship of good communication. So we actually know what is important to the parent, what is important to the child, what is their question, and also what are their fears, what are their concerns. We had a patient where something had gone bad in a previous surgery and they were very afraid. And so identifying that and then speaking with them and really making sure the next time, not just the condition is addressed, but also all their other needs. That's really important to me because I treat the whole family as a unit, not just the patient or not just an appendix.
Yeah, as a mom, I really appreciate hearing that. It's so important because it really is a family affair when you're taking your child in to be seen. If a parent did have a concern and think that their child might need surgery, what should they do?
Yeah. For most parents, the journey starts with a pediatrician or the family doctor, and then they get referred to us.
Mm-hmm.
And then we see them either in the clinic or today we do a lot of telehealth or a lot of video visits or Zoom visits or just telephone calls. And we can address a lot of questions on the phone. And, we're available, we're reachable, we're around, we can talk to people. And so that's what I would recommend, right? Go talk to your pediatrician, or if it's something that feels more urgent, go to an urgent care, and then they know how to find us. We're available 24/7, and there's always a pediatric surgeon available to take care of them.
Well, thank you so much, Dr. Stair. I really appreciate your calm, reassuring words and giving us so much good information today about pediatric surgery and how accessible it is. Any parting comments you would like to share?
Yeah, it's, I am somewhat new to Albuquerque. I moved here 3 years ago, and I started out as a traveling surgeon, but I liked it so much that just a month ago, we actually bought a house, and we now live in the North Valley.
Oh, wow,
And
congratulations.
I feel like I'm finding a new home here.
That's wonderful. Well, we're glad that you're a part of the Presbyterian family, and we wish you well during these times and glad to have you on board. Thank you so much.
Thank you, Courtney.